Autism is a pervasive developmental disorder that often interferes with a person's ability to communicate with and relate to others. Dr. Phil Schwartz of Children's Hospital of Orange County explains this multifaceted disorder and the effect it can have on a family.
Well, autism is a disorder of the brain, and it affects behavior in kids. That's when it's first noticed. It can last lifelong. There's sort of three basic types of behavior it affects, but the one that seems to be has the biggest impact on families is social interaction. So they can't interact normally as a child would with their parents, and they're very cold. They can't show love as we know it, and they have some other interesting behaviors where they will concentrate on a truck and only one truck in their entire toy collection to the exclusion of everything else. Or they may do certain things over and over and over and over again. So these types of behaviors interfere with their ability to sort of grow up in society as we have it designed right now, pass milestones, make it into grade school, and interact with other children. And so it's pretty devastating. So some autisms are definitely familial. And some there is a component that may be contributed by the environment. And there have been a lot of theories about this, but the running theory that I ascribe to is that this is a component that the child is exposed to in utero, not after birth, but before birth, when the brain is being laid out in some of its most high-level complexity. And so some of these things might be simple viral diseases that the mother is exposed to, et cetera. So there's a component of both, genetic or familial, as you put it, and environmental, as other people put it. Here in Orange County, we have a pretty nice system that's being developed, both within the CHOC set of clinicians, as well as some partners where we have some autism schools. These are schools specifically tailored for kids with autism. We also in the state have the developmental centers and the regional centers that have been following these patients for decades now. So we have a good handle in California on our autism population, and we have some pretty good mechanisms in place to help them. The schools is the real issue. It's difficult to mainstream an autism child that has severe autism into a classroom of normal children. It's disruptive for everybody. So there really needs to be a subset of schools, and those are being developed here in Orange County as we speak. There's a grandparents autism network that specifically tailored to meet the needs of grandparents, because in many cases the parents are young, they're overwhelmed with everything they have to do just running a family, and the grandparents are often called in to help. And the grandparents don't know what to do either. So there is a grandparents autism network here in Orange County specifically for you.